I'm about to tell you something that could save your life, and it has to do with what you put in your mouth in the first 30 minutes after you wake up. Most seniors have been told, watch your sugar, avoid desserts, take your pills. Very few have been told that a common healthy breakfast habit can quietly spike their blood sugar by up to 40%, exhaust their pancreas, and push them from pre-diabetes into full-blown diabetes faster than almost anything else they do all day. I'm Dr. Claire Whitmore, and after 2 decades as a cardiologist, I've treated thousands of adults over 60 whose hearts were damaged by diabetes and high blood sugar. Again and again, when I ask, tell me exactly what you eat for breakfast, I hear the same pattern: juice, cereal, white toast, a banana, maybe a little flavored yogurt, and very little protein or fiber. On lab reports, I see the same thing: morning sugars spiking, a 1C creeping up, and eventually heart attacks and strokes. By the end of this video, you'll know exactly what that morning mistake is, why it hits seniors' blood sugar so hard, and how to build a new morning routine that flattens those spikes, protects your heart, and can even lower your A1C over the next few months. I'm not going to name the mistake just yet, because if I do, some of you will say, "Oh, I already know that. Write down one sentence and leave." You need to understand what's happening inside your body first. Before we go on, comment below with your age and what you usually eat or drink in the first hour after waking. Something like 72 coffee and toast, 80 juice and cereal, 68 eggs and fruit, or 75 just coffee. I read these. I need to see what seniors are actually doing in the morning. Let me tell you about Leonard. Leonard was 72 when I met him, a retired postal worker, married, 2 grown daughters, 3 grandkids. On paper, he was not too bad for his age, as his primary doctor liked to say. He was 5'9", 192 pounds. His blood pressure usually ran around 136/82 on a single pill. His LDL cholesterol was 112, HDL 49, on a low-dose statin. His A1C, that 3-month average of blood sugar, was 6.1%, pre-diabetes. At his annual visit at 69, his doctor had told him, "Your sugar's a little high. It's called prediabetes. Lose a few pounds, watch the sweets, and you'll be fine." Leonard took that seriously. He went home, threw away the cookies, and started reading food labels. He did what many of you would do. He tried to build a heart-healthy breakfast. Here's what that looked like every morning, almost without fail. He'd wake at 6:30 a.m., pour himself a tall glass of orange juice. He made sure it said 100% juice. No sugar added, because that sounded healthy. Then he'd have a big bowl of whole grain cereal, the kind in a box with a heart symbol on it, with 1% milk and a sliced banana on top. Sometimes, on days he felt especially virtuous, he'd have instant oatmeal instead, made from a packet, with a spoonful of raisins and a drizzle of honey. He almost never ate eggs. Too much cholesterol, he'd say. He rarely had plain yogurt. Too sour. He felt very proud of his choices. At his next checkup, he told his doctor, "I've really cleaned up my breakfast. Juice, whole grains, fruit. I hardly ever eat bacon or eggs anymore." The doctor nodded approvingly. "That sounds very heart healthy. Keep it up." No one asked what happened to his blood sugar after that breakfast. Over the next year, Leonard noticed some changes. Around 10:30 or 11 a.m., a few hours after breakfast, he often felt shaky, ravenous, and tired. He'd think, "I guess I need a snack," and grab a granola bar or another piece of fruit. His weight crept up a few pounds. At his next lab draw, his fasting sugar was 118 milligrams DL, and his A1C had nudged up to 6.4%. Still pre-diabetes, his doctor said. "We'll keep watching it. Try to get more exercise, maybe cut down on portions." Leonard doubled down on what he thought was healthy. He resisted desserts. He switched to a cereal with extra fiber. He poured slightly smaller glasses of juice. The problem was he was still making the same core mistake, starting his day with a huge load of naked carbs, sugar and starch with very little protein or fat to slow it down. 6 months later, the warning signs got louder. He started waking up at 3 or 4 a.m. I was saying to Liz, echo, sweaty and wired, then crashing back to sleep. He felt more tired in the afternoon and often nodded off in his recliner. He brushed it off as getting older. Then came the morning. Everything changed. It was a Monday in late May. Leonard woke at 6:30, had his usual big glass of orange juice, poured a generous bowl of cereal, and topped it with banana. He ate quickly. He had an 8 a.m. appointment with his dentist. By 7:15, he was rinsing his bowl when he noticed a strange heaviness in his chest. Not sharp pain, but like someone had set a brick under his breastbone. He thought maybe it was indigestion. He took a couple of antacid tablets and went to brush his teeth. As he stood at the sink, the heaviness spread into his left shoulder and up into his jaw. He felt slightly short of breath. He looked at his face in the mirror, a little pale, maybe. He told himself, "Don't be dramatic, you just ate too fast." By 7:30, on the drive to the dentist, the pressure intensified. He began to sweat, his hands trembled on the steering wheel. He felt lightheaded. At a red light he thought, maybe I should turn around, or call someone. But he kept going. In the dental chair as the hygienist reclined him, the chest pressure flared. He suddenly felt nauseated. His heart pounded. The hygienist took one look at his face and said, "Mr. Davis, you don't look well. Are you okay?" I don't feel right," he said. "My chest..." She stopped immediately and called 911. The dentist came in, checked his pulse, which was rapid and irregular, and stayed by his side until the paramedics arrived. In the ambulance, they got an EKG. It showed concerning changes, ST depression and T-wave abnormalities, suggesting he was having a non-ST elevation heart attack. His blood pressure was 172/94. His heart rate was 104. When they checked his blood sugar with a finger stick, it read 264 milligrams DL, barely an hour and a half after his healthy breakfast. He had no idea his sugar could go that high. In the emergency room, his blood work confirmed an acute coronary syndrome. His troponin, the enzyme that indicates heart muscle damage, climbed over the next several hours. His A1C, drawn that day, came back at 7.8%. Somewhere in the past year, his borderline sugar had quietly turned into full-blown type 2 diabetes. We took him to the cath lab and opened a tight blockage in his left anterior descending artery, the so-called widowmaker. He was lucky. We got to it before it fully closed, but the damage was done. His heart function on echocardiogram was now moderately reduced. He was left with heart failure symptoms he had never had before. In the days after his procedure, he lay in the hospital bed hooked to a heart monitor, asking the same question I've heard from so many seniors. How did this happen so fast? I don't eat candy, I don't drink soda, I eat healthy cereal and fruit. When the diabetes educator visited and reviewed his continuous glucose monitor readings from the hospital, something became clear. His blood sugar spiked dramatically after breakfast, 200, 230, sometimes 250 milligrams DL, then crashed mid-morning, then climbed again after lunch and dinner. His biggest spike, day after day, was after his perfect breakfast. Here's the part that still makes my stomach tighten. This wasn't just bad luck, it was predictable. It was, to a large extent, preventable. Leonard's morning mistake, starting his day with a glass of juice and a big bowl of fast-digesting carbs with almost no protein or fat, was causing huge sugar spikes, roughly 30–40% higher than what he saw when he later tried a protein-rich breakfast in the hospital. Those repeated spikes over months and years put enormous strain on his aging pancreas, sped up the progression from prediabetes to diabetes, damaged his blood vessels, and helped set the stage for that heart attack. If, when he was first told he had prediabetes, someone had sat him down and said, "The most dangerous sugar in your day is not the dessert, it's the unbalanced breakfast that looks healthy," his story might have been very different. If he had rebuilt his breakfast with protein, fiber, and healthy fats first, and pushed juice and refined carbs out, or at least to the end of the meal, his post-breakfast sugars might have been 30–40% lower. His pancreas would have had a break. His A1C might have stayed near 6 instead of climbing toward 8. That heart attack at 72 might have been delayed for years or avoided. I want you to pause and be honest with yourself. Comment below with a simple format: age, usual breakfast, for example, 70 orange juice and cereal, 82 toast and jam with coffee, 66 eggs and toast, 78 oatmeal with raisins and honey. If your breakfast is mostly carbs and sugar, juice, white bread, sweet cereal, pastries, flavored yogurt, add the word carbs. If you have diabetes, pre-diabetes, or don't know your A1C, add diabetes, pre or unknown. So your comment might look like 74 juice and toast carbs pre. This is not about shame, it's about seeing clearly what your pancreas is dealing with every single morning. Let's talk about what's actually happening inside your body when you make that morning mistake. When you wake up, especially as an adult over 60, your hormones are already nudging your blood sugar upward. This is called the dawn phenomenon. In the early morning hours, your body releases cortisol, growth hormone, and other hormones that tell your liver, release some sugar, it's time to wake up. That's why many seniors see a fasting sugar that's a bit higher than their bedtime sugar, even if they didn't eat overnight. In a younger, very healthy person, the pancreas responds to that morning hormone surge with a quick, strong burst of insulin. Blood sugar rises slightly, then flattens. In many adults over 60, especially with pre-diabetes or diabetes, that first phase insulin response is weaker and slower. The pancreas is tired. It can still make insulin, but not as fast or as precisely. Now imagine that. Into this situation, your liver quietly dripping sugar from the dawn effect, your pancreas already working. You pour a large glass of juice and a big bowl of cereal or white toast. These are what I call naked carbs, fast digesting sugars and starches, with little or no protein, fat or fiber to slow them down. Juice, even 100% juice with no sugar added, is essentially liquid sugar. An 8-ounce glass of orange juice can contain 22–26 grams of sugar, the equivalent of 5 or 6 teaspoons, and very little fiber. Most people pour closer to 12–16 ounces, not 8. Many boxed cereals, even those marketed as whole grain or heart healthy, are highly processed. They break down quickly into glucose. White toast, instant oatmeal with sugar, jam, honey, it's all more sugar and fast starch. In multiple studies, this kind of breakfast causes a sharp rise in blood glucose within 30–60 minutes, often 40% higher than the peak after a balanced breakfast with the same calories but more protein and fiber. In one trial, adults with type 2 diabetes who ate their carbs first saw post-meal blood sugars nearly 40% higher than when they ate the exact same carbs after eating protein and vegetables. When you eat naked carbs on an empty stomach, you are essentially throwing gasoline on the small fire of the dawn phenomenon. Seniors are especially vulnerable for 4 reasons. First, your muscle mass is lower. Muscle is where a lot of post-meal glucose goes to be stored. Less muscle means less storage space and higher spikes. Second, your insulin response is slower and sometimes blunted. The pancreas doesn't hit the gas pedal as fast. The sugar wave outruns the insulin. Third, your digestive system may be a bit slower, but juices and refined carbs don't need much digestion. They rush into the bloodstream long before your body can catch up. Fourth, decades of wear and tear on your blood vessels mean that every spike does more damage. High peaks of glucose inflame and roughen the inner lining of arteries, contribute to plaque formation, and make your blood more sticky, which increases the risk of clots. Research backs this up. Studies in journals like Diabetes Care and the American Journal of Clinical Nutrition have shown that when adults, especially those with diabetes or prediabetes, eat a high-starch, high-sugar breakfast, their post-meal glucose can be 30–40% higher than after a low-glycemic, high-protein breakfast of similar calories. Other work has shown that simply changing the order of foods, eating vegetables and protein first, then carbs, can reduce the post-meal spike by roughly that same percentage. Why does this matter so much? Because it's not just about that one spike. Your breakfast sets the tone for your whole day. Large, rapid glucose swings in the morning make you hungrier, more tired, and more likely to overeat or choose high-carb snacks later. They keep insulin levels high for hours, which makes it harder for your body to burn fat and easier to store fat in your liver and around your organs. Over months and years, those repeated hammer blows, spike after spike, drive the progression from prediabetes to diabetes and damage your heart and brain. Here's the contrarian truth. For adults over 60, the most dangerous sugar you eat may not be dessert. It may be your breakfast. And the one morning mistake that spikes your blood sugar by up to 40% is this. Starting your day with naked carbs, juice, white or refined grains, sweet cereals, pastries or sugary yogurt, without enough protein, fat and fiber, and especially eating those carbs first, on an empty stomach. So what do you do instead? You do not have to give up every carbohydrate. You do not have to eat like a bodybuilder. But you do need to flip the script on your mornings. Protein and fiber first. Carbs last and in smaller amounts. No liquid sugar on an empty stomach. Let me give you a concrete plan. Step 1. If you have a glucometer at home, collect a little data before you change anything. For 3 to 7 days, check your fasting sugar when you wake up. Then eat your usual breakfast. Check your sugar again 1 hour after the first bite and again at 2 hours. Write those numbers down, along with what you ate. Many of you are going to see exactly what Leonard never saw, a jump of 40, 60, even 100 points after breakfast, and numbers well above 180 milligrams LDL. If you don't have a glucometer, you can still watch your symptoms: mid-morning shakiness, intense hunger, fatigue, brain fog. Those are often the crash after a huge spike. Step 2. Commit to no more naked carbs in the first hour after waking. That means no juice as your first drink. If you love juice, we'll talk about how to use a very small amount later with food. No sweet coffee drinks loaded with flavored creamers and sugar on an empty stomach. No big bowls of refined cereal or white toast with jam as your only breakfast. Instead, when you wake up, drink water first, 16 ounces. Then have coffee or tea if you like, but as plain as you can tolerate, black or with a small amount of milk or cream, and minimal sugar. Then within about an hour of waking, eat a breakfast that includes at least 15-25 grams of protein, some healthy fat, some fiber-rich, low glycemic carbohydrates. What does that look like in real life? It might be 2 eggs, about 12 grams of protein, scrambled in a teaspoon of olive oil, with a slice of whole grain toast and half an apple, a cup of plain Greek yogurt, 15-20 grams of protein, with a couple of tablespoons of nuts and a small handful of berries, half a cup of old-fashioned oats cooked in water, with a spoonful of peanut butter or a scoop of cottage cheese stirred in for protein, and a sprinkle of chia seeds. Notice the pattern. Protein first, carbs surrounded by fiber and fat, no naked sugar. Step 3. If you're going to eat carbs, toast, oatmeal, fruit, even a small amount of juice, change the order. Several small but well-designed studies have shown that when adults with type 2 diabetes eat their protein and vegetables first and their carbs last, their blood sugar spike after the meal can be about 30-40% lower than when they eat the carbs first. The total food is the same, the timing is different, and so is the glucose curve. So if your usual breakfast is eggs, toast, and orange juice, try this. First, eat your eggs and any non-starchy vegetables you might include, like sautéed spinach or tomato slices. Then eat half your slice of toast with a little butter or avocado. If you're still hungry and absolutely want juice, have no more than 4 ounces at the end. That's half a cup, not a 12-ounce glass at the beginning. If your breakfast is yogurt, fruit, and granola, try eating the yogurt with nuts or seeds first, then the fruit mixed in, and finally a small sprinkle of granola on top, not a bowl of granola with a spoonful of yogurt. Step 4. Pair your new breakfast with a few minutes of gentle movement. After you eat, if you are able, take a 5-10 minute walk around your home, yard, or hallway, or do simple seated marching. This light movement helps your muscles soak up glucose and can shave down that post-meal peak. Step 5. Coordinate with your medications. If you are on diabetes medications, metformin, sulfonylureas like glipizide, insulin, or others, do not change the dose or timing on your own. As you improve your breakfast and your overall control, your medication needs may change, but those adjustments must be made with your doctor. The goal is to avoid both high spikes and dangerous lows. At your next appointment, bring your breakfast log and say, "I've changed my morning routine. I'm eating protein-rich, low-sugar breakfasts and avoiding juice. Here are my home sugars. Do we need to adjust my medications?" Step 6. Give this at least 4 to 8 weeks. Your A1C is a 3-month average. You will not see it change overnight. But many seniors notice things within days. Less mid-morning shakiness, fewer sugar crashes, more stable energy, less brain fog. Over a few months, if you stick with it, many see their fasting sugars drift down and their A1C drop by 0.5–1.0 percentage points, sometimes more, without adding new drugs. Seniors ask me a lot of questions about this. What if I'm just not hungry in the morning? Start small, but your hunger hormones have adapted to your old pattern. Over a week or two, they can shift. Even half a Greek yogurt with a few nuts, or 1 boiled egg and half a slice of whole grain toast is better than nothing. The key is some protein and fat with any carbs you eat, and avoiding liquid sugar on an empty stomach. What if I already have good sugars? Do I need to change? If your A1C is in an excellent range, your fasting and post-meal sugars are steady, and your breakfast is already balanced, you may not need major changes. But many seniors with good fasting sugars never check after meals and are surprised to see big spikes. It's worth checking at least a few times. What about intermittent fasting, skipping breakfast? This can be tricky for adults over 60. Some research on time-restricted eating shows benefits, but much of it is in younger or middle-aged adults. For many seniors, especially with diabetes, blood pressure medications, or frailty, long fasts and a big lunch can worsen glucose spikes and risk low sugars. If you're interested in fasting, talk to your doctor and strongly consider early time-restricted feeding, eating breakfast and lunch, finishing dinner early, rather than skipping breakfast and having a huge evening meal. What if I'm underweight or have poor appetite? Then the priority is preventing further muscle loss and keeping sugars steady, not drastic carb cutting. A small nutrient-dense breakfast with protein, like scrambled eggs with cheese or yogurt with nut butter, may help both weight and blood sugar. This must be tailored with your doctor or a dietitian. Is fruit bad at breakfast? Whole fruit in reasonable portions is generally fine, especially lower glycemic options like berries, apples, or pears, when eaten with protein and fat. A whole orange is better than orange juice. Bananas, grapes, and tropical fruits are more sugary, have smaller portions, and pair them with protein. Juice is where many seniors get into trouble. It's just too concentrated and too fast. Now I want to tell you about someone who turned things around. Rosa was 79 when she came to see me. She was 5'2", 170 pounds, with long-standing type 2 diabetes, high blood pressure, and high cholesterol. Her A1C was 8.2%. Her fasting sugars were often 150–180 milligrams DL. Her morning routine for the past 20 years: coffee with 2 sugars and flavored creamer, 2 slices of white toast with jam, sometimes a small glass of orange juice for vitamins. When I asked her, "Have you ever checked your sugar after breakfast?" she laughed. "No, they just check it fasting at the lab." I had her check at home, fasting 162 1 hour after her usual breakfast, 258 2 hours after 230. She was stunned. We didn't put her on a complicated diet. We focused on one thing: fix breakfast. For the first month we agreed on this: morning coffee with a splash of milk and no sugar. If she missed the sweetness, she could use a small amount of a non-sugar sweetener, 2 scrambled eggs with a small amount of cheese, plus half a slice of whole grain toast with a thin smear of avocado. No juice. If she wanted fruit, half an apple or a few berries after the eggs. She also started walking in her hallway for 5 minutes after breakfast, holding onto the wall. In week 1, her 1 hour post-breakfast sugars dropped from the 250s to the 170s, 180s. By week 3, with the same medications, her fasting sugars were in the 130s, 140s, and her post-breakfast numbers were mostly under 160. At 3 months, her A1C had dropped to 7.4%. She had lost 5 pounds without trying. She told me, "I don't crash at 10 a.m. anymore. I don't feel like I'm on a roller coaster." Over the next 6 months, working with her primary doctor, we were able to slightly reduce one of her diabetes medications because her home sugars were so much more stable. Her breakfast wasn't fancy, it wasn't perfect, but that one change: no naked carbs, protein first, cut her morning spikes by 30–40%, lightened the burden on her heart and blood vessels, and gave her more energy for the day. I think about Leonard every time a senior tells me, "I have a healthy breakfast, juice, cereal, fruit, and my sugar is still creeping up. I guess it's just my genes." I picture his heart-healthy cereal box on the counter, the tall glass of orange juice sweating by his plate, and his pancreas pushing out insulin as fast as it could, morning after morning, year after year. I picture that EKG in the dentist's office and the look on his face when he saw his blood sugar in the 200s for the first time. You now understand that, for adults over 60, the dawn phenomenon and a slower insulin response make your body especially vulnerable to big carb loads in the morning. The common breakfast of juice, refined grains, and sugary foods, even when labeled healthy, can spike your blood sugar by 30–40% more than a balanced breakfast with the same calories. These repeated morning spikes don't just make you tired and hungry, they accelerate the progression from prediabetes to diabetes and damage your heart, brain, kidneys, and eyes. You can dramatically flatten those spikes by avoiding naked carbs at breakfast, putting protein and fiber first, keeping any carbs modest and eaten last, and adding a bit of gentle movement after you eat. This information is power, but only if you use it. Tomorrow morning, don't just reach for the juice and cereal out of habit. Drink a glass of water. Make a simple protein-rich breakfast: eggs, Greek yogurt, or oatmeal with added protein. And if you include carbs, put them at the end of the meal and in smaller portions. If you have a glucometer, start checking your sugar 1 and 2 hours after breakfast and write down what you see. Over the next few weeks, watch how those numbers change as your breakfast changes. Bring that log to your doctor and say, "I've fixed my morning mistake. Can we talk about what this means for my medications and my long-term risk?" Before you go, do 3 things. Subscribe if you want more direct, no-nonsense guidance about protecting your heart, blood sugar, and independence after 60. Share this video with at least one friend or family member over 60 who starts their day with juice, cereal, or toast. You might prevent the next Leonard. And leave a comment with one of 3 phrases: juice and carbs, if that's been your usual breakfast; protein breakfast, if you're committed to changing starting tomorrow; or talking to my doctor, if you're going to bring your morning sugars and breakfast log to your next appointment. Your first meal of the day can quietly push you toward diabetes or gently pull you away from it. Starting tomorrow, choose the path that protects your heart, your pancreas, and your future. Disclaimer: the content in this video is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician regarding your medical condition. Never change your medication dosage or timing, or start a new diet or exercise routine without consulting your doctor.